So today we're going to be looking at the BGL chart or blood sugar chart. It's also known as the insulin chart. This chart is used mainly for two purposes. The first is to record the blood sugar level, which is in this colored sort of area. And the second purpose is to document when and the amount of insulin that was given, which is in this area here. If you haven't learned how to administer insulin yet, or if the patient doesn't require insulin, that's okay. You would still complete the blood sugar level in this chart if you have only taken a blood sugar. All right, so I've conveniently used different colored pens for you in this chart to indicate the blue is the area that the physician fills out, the doctor, and the red is the area that the nurse is responsible for completing. So we're going to begin by covering what the doctor must have filled in for the nurse to be able to do her job. So to begin up here on the left-hand corner, you've got the patient's label and the blood sugar frequency. So basically, how frequently should the blood glucose levels be checked? Here, the doctor has indicated they want it checked standard, which is pre-meals, and 2100. Which is 9 o'clock. If they had X'd off at 0200, that means at 2 o'clock in the morning, you would be waking up your patient to take their blood sugar. This is important because patients can go hypoglycemic in the middle of the night, and it's difficult to tell the difference between a sleeping patient and an unconscious patient. So we do wake them up if the doctor has to take this off. There are special instructions here that the doctor has requested that he be called if the blood sugar is greater than 20 millimoles, and sometimes they add in other instructions. Down here, we've got the routine insulin orders. Oops, sorry. This is written day to day. So this was written on the 4th of, or for the 4th of the 10th. And the doctors conveniently filled out the next few days as well, the 5th of the 10th, the 6th, and the 7th. However, they don't necessarily have to fill it out multiple days in advance. On the 7th of the 10th, the doctor could come in, assess how the patient has been reacting to the current insulin amounts, and then determine what will be administered the following day on the 8th. So if we look here at 0800, when the patient has breakfast, the doctor would like NovoRapid 4 units given. Now, as long as the patient is not hypoglycemic or fasting, then we would give this amount. Okay, if they are hypoglycemic, so blood sugar less than 4, or if they are not eating food due to being about to go to theater, or being nil by mouth, or stroke, or nausea, if for any reason they are not eating, we would consult with the charge nurse or the doctor prior to administering the insulin. At 12 o'clock, the doctor would also like 4 units of NovoRapid given today. At 1700, he'd like 6 units. So this dose has been, it's a little bit higher than breakfast and lunch because people tend to eat more as well as heavier meals at dinner time. And then at 2100, the doctor has ordered a different type of insulin, Lantus, which is a long-acting insulin that will get the patient through the long night. And the doctor has ordered 20 units. So, we'll look at the supplemental insulin section in a little bit, but looking over here at what the nurse has documented. So on the 4th of the 10th, we'll say that's today, the patient has been eating a full ward diet. Realistically, if he's a diabetic, it should be a diabetic diet, so that's something the nurse should look at changing. At 7:30 in the morning, which is half an hour before breakfast, the blood sugar was taken and it was 4.2. We do expect it to be a little bit lower first thing in the morning, but as long as the patient's not hypoglycemic, that's the important part. Generally, we want to take the blood sugars within 30 minutes before the meal arrives on the ward. So at 7:30, the blood sugar was 4.2, and then at 8 o'clock, the nurse administered 4 units of NovoRapid. And you can see there's 2 nurse initials here because it takes 2 nurses to check and administer the insulin. At 11:30, the patient's blood sugar level was 10.7, and 4 units of NovoRapid was administered at 12 o'clock when lunch arrived on the ward. We only ever administer insulin when food is on the ward, okay? Because if we administer the insulin early and then for some reason there's a delay in the food arriving to the ward, the patient is at risk for going hypoglycemic. All right, so finally here at 16:30, the patient's blood sugar was 12.4. Now, at dinner time, 6 units of NovoRapid has been ordered, which was administered, but this is where the supplemental insulin orders come in. So you'll note that 12.4 is in the yellow category. Well, down here under supplemental insulin orders, the doctor has indicated that between 12.1 and 16 in the yellow, he wants us to administer an extra 2 units of NovoRapid with meals only, so that's only 3 times a day, if the patient's blood sugar is a little bit elevated above normal, which in this case it is. So the nurse administered the regular 6 units of NovoRapid from down here, plus 2 units of NovoRapid from down here. Both of these, because they're NovoRapid, they can be administered in the same syringe, and this was given at dinner time. We know that at bedtime, which will be 2100, the blood sugar should be rechecked again, and the nurse will be administering Lantus. So in this case, she'll document the units down here. Just to add on, if the blood sugar is less than 4, the doctor should be notified immediately, and there's a management protocol we're going to look at. And up here, if the blood sugar is 3 times consecutively in the yellow, so greater than 12, then we also need to notify the doctor. However, because we've administered the supplemental insulin in this case, hopefully at 2100 when we recheck the blood sugar, we'll be back down into the white, so we won't need to notify the doctor. If it's greater than 20, you will notify the doctor immediately. Okay, so I want to just move down to the other side of this document. So there's 2 sections, guidelines for managing hyperglycemia and hypoglycemia management. So let's look at hypoglycemia management first. This is if the blood sugar is less than 4 millimoles. This is an emergency situation and it must be dealt with immediately. So all the nurse needs to do is follow these instructions. Is the patient conscious and cooperative? Yes. Are they on an insulin infusion? No. Are they nil by mouth or nil by tube, meaning you can't give them any food? No, they can eat what they want. Is the patient receiving food orally or by tube? Yes, they are. So in this case, we would give them 1 serving of fast-acting carbohydrates from the list below. Okay, and then we're going to recheck the blood sugar after 15 minutes. So let's look at this list down here. Fast-acting carbohydrates, 100 mils of Lucozade, or 150 mils of lemonade or another soft drink, not diet for obvious reasons, we want the sugar, or you can give them 4 large jelly beans or packets of sugar dissolved in water. You can give them orange juice or cordial as long as it's not diet. So these are your options. And then you're going to administer the patient. Then you're going to recheck the blood sugar after 15 minutes. If it's greater than 4, then you're going to give them food from a slow-acting carb. So slow-acting carbs, we're looking at basically protein. So yogurt, bread, fruit. Those aren't so much protein, but they are slower-acting carbs or pureed fruit. Okay, milk also works well. If their blood sugar was still less than 4, then you move back up and you give another fast-acting carbohydrate. So this is if the patient can eat. Okay, and they're fully conscious. Those are 9 times out of 10 the situation you're going to come across. If they are unconscious or there's other concerns, you're going to follow the instructions in the rest of this chart. Moving over, guidelines for managing hyperglycemia alerts. You'll see that it talks about checking for ketones, which you will learn about how to do in class. But generally, the important part in managing hyperglycemia is to adjust the insulin, which is the responsibility of the doctor. So generally, this side of the chart is what doctors are going to be following for hyperglycemia, whereas nurses are responsible for following for the chart for hypoglycemia. Thank you.